Yes.
Welcome, everybody, back to Clear Vision today. I have the logo in back of me today, Dr. Fagoura's logo. Dr. Param Fagoora is board-certified ophthalmologist, one of the leading eye surgeons here in Fresno. And today, he is going to talk about some very common eye conditions that his practice treats and that will touch most of us, either one or the other along the way. Myopia, hyperopia, astigmatism, presbyopia, and minor eye irritation. And I just have to tell one little quick funny. When I first was told by an ophthalmologist, Tom, you have presbyopia, I said, I've studied Greek. I know you're saying my eyes are old. So let's hear the real medical information, Dr. Fagoora.
The myopia falls under one of the refractive conditions. And what this means is a person can see objects at hand or close by and cannot see the objects far away. And that makes it difficult for the person to do his job. And myopia starts in the early childhood and continues to advance in the teen years. The eyeball functions like a camera. The image of the object of regard has to focus on the retina to see clearly. In a myopia, the image is focused in front of the retina or falls short of the retina, so the image is blurred on the retina, and so it is perceived as a blurred image by the brain. We are very alarmed with this condition of myopia because the children are alarmingly in huge numbers getting myopic. Now, we are concerned to prevent myopia as much as we can because this interferes with your daily life activities. It's a financial burden to get glasses and contact lens surgical correction. And also you have to look for glasses if they're lost. Now, what causes myopia? Let's go over that in brief. Number one, if you have parents who are myopic, a child has more chance to develop myopia. So for the parents who are myopic, they should get their child examined as early as 6 months to 3 years to make sure their eyes are developing normally and they are not getting myopia. The symptoms of myopia will be that a child is squinting to see far objects. Number two, the child is not interested to go to school because he's not learning from blurred vision in the school. Number three, he may complain of eye aches or headaches because of blurred vision and straining the eyes. So if you know any of these symptoms in your child, get it examined.
Dr. Fagoora, I don't mean to interrupt, but I do actually. If a child is myopic and they may not realize that that's not the way the world looks, is that
Yes.
possible?
So that's why if the child is squinting or says, I cannot see what you see, like your parents are driving and the child is, I can't see what you're seeing, like the street signs, that's a sign to watch. Or they're sitting close to TV, or they're holding objects close by, that alarms you, the child may have vision problem.
Yes.
So now, what I advise parents that if you have a myopic child, number one thing is it should be examined to see how much myopia it is. If the myopia is more than a -5 diopters, it can cause other eye conditions like retinal detachment, glaucoma, cataract, and myopic maculopathy. So we want to arrest the myopia as much as possible. And the recommendation is 20-20-20 rule. Have your child do the eyes for 20 minutes and look for 20 seconds far away, which means more than 20 feet away. What happens is when a child is looking at close objects like any iPad or TV, the eye muscles are contracting to make the eye look near, and that causes pressure on the eyeball, and the eyeball elongates. When the eyeball is longer than a normal person's eyeball, it causes myopia. Also, there are different styles of contact lens and glasses to help in the arrest of myopia, like there are contact lenses that cause peripheral vision to be blurry, and that helps in the rest of the eyes. There is a contact lens that makes the shape of the cornea a little flatter. You put it at night and take it in the morning. Orthokeratology. Progressive lenses. And after your eye has stabilized for 2 to 3 years, and you're more than hopefully 18 years of age, because by 18 years of age, most of the people stabilize for myopia. Some still keep progressing. You can get laser vision correction done, or if you're very highly myopic, laser vision correction is not in the range to be corrected, then you can get an intraocular lens in the eye. I think these are very good advancements for people who are myopic. Myopia can be corrected in normal range, teenage year with glasses or contact lenses. Now let's talk about the next condition called hyperopia. As we discussed myopia, the image falls short of the retina, and in hyperopia, the image falls behind the retina, so the image is blurred. The reason person gets myopia is that you have a shorter eyeball, or your corneal curvature and the lens curvature are not normal. They are short of what they should have been. Again, symptoms of hyperopia is a patient can see far away, but finds difficulty to look near. Again, complains of blurred vision, squinting, and again, cannot read the near text. So if you see those symptoms, the child has a problem with hyperopia. Sometimes a hyperopic child can also develop crossing of the eyes called esotropia. So if you have a child who is crossing the eyes, may also have hyperopia, and glasses can correct either a full amount of strabismus or at least partial amount of strabismus. Now again, the hyperopia can be corrected with glasses, contact lenses, laser vision correction, or if you have a too much hyperopia, then an intraocular lens in the eye. The next refractive condition important is astigmatism. Astigmatism is called when the corneal or the lens curvatures are not the same in both directions. Both directions mean horizontally and vertically. So image that should be focal point 1, the image is seen as 2 focal points. The image can be, both images can be in front of the retina, although it can be both behind the retina, or one image could be in the front of the retina and the other image is behind the retina. So these are classified as simple astigmatism or a mixed astigmatism. Again, the astigmatism can be corrected with glasses, contact lenses, and surgery.
Is that why people squint with astigmatism? Is they're trying to regulate their
in astigmatism,
focus?
I tell the patient, your child's eyes like a football should be like a baseball.
Yeah, that's what I've heard. Yeah.
And also sometime if the cornea is not normal strength, collagen fibers in the cornea are not strong enough, you can develop a coning of the cornea called the keratoconus. And that also is an astigmatism of the cornea, but you cannot correct this normally with glasses or contact lenses and may need corneal transplant or cross-linking, which is a UV radiation along with vitamin B6 to make the corneal tissue stronger.
Mm.
The condition of presbyopia. As you reach age 40 plus, the lens in the eye is getting thicker, less moldable, and the muscle that used to mold the lens is also getting weaker every year. So person says my arm is getting short, which means he has a hard time seeing near objects unless he extends his arm. So depending on the age group, presbyopia again can be corrected with glasses or with contact lenses. And if you are over the age of 70 or you have a cataract, we have multifocal intraocular lenses now to help the condition of presbyopia. Again, we all need to take good care of the eyes, and all the refractive errors are very common, as actually myopia, as I said before, is getting very, very common. So we need to teach our pediatricians, need to teach our younger parents to watch for this so that children do not have this condition, or at least we can stop the progression of myopia.
Yes. Did you want to talk a little bit today about minor eye irritations?
Minor irritation is again very common. People neglect it. Number one cause that I see in the office is the dry eye. Dry eye is caused when the tear film is not healthy. It could be because the lid gland that produces a lipid layer, or it could be that your lacrimal gland that produces the aqueous layer of the tear film are not of normal quantity. The person says, I feel like my eyes are tired all the time. I cannot see as good as I used to, or I cannot use my computer. I have to blink a lot. The first thing I see a patient in the office, I notice how their facial skin looks like. The facial skin acne rosacea is very common in people who have a fair skin. So I advise them how to control the acne rosacea. Next, I look at how often they are blinking compared to my blinking. Even I have a dry eye, but they blink more often than I, so immediately there's a problem. So I tell them that you're blinking more often and you're trying to make your eyeball or your cornea wet by frequent blinking. And when I check them, their glands are all blocked. And I put a dye to check the dry eye. That dry stains their cornea or their conjunctiva, or there are folds in the conjunctiva because of long-standing or long duration inflammation of the conjunctiva. So I advise them warm compresses, massage, a lot of green leaf vegetables, and eye drops to decrease the inflammation in the eye. The second cause again comes to the lids for irritation, blepharitis. When you get blepharitis, your lid glands are inflamed, your lids are swollen, and again, you feel irritation. So we again advise them, depending on the reason of the cause for the eyelid swelling, warm compression, antibiotics. The third reason I want to stress is eye makeup. The ladies who use eye makeup past the time of expiry, they have a chemical that causes irritation. When you apply those to the eyelashes, they trickle down onto the eyeball and cause irritation. My recommendation in general is do not use the eye makeup because always gets infected after you've been using this for a couple of months. If you want to look beautiful, use a liquid liner behind the eyeball. Next, fourth reason would be allergy of the eyes. We can be allergic to anything in the air, dust, pollens, grass, animal dander. So we need to be cautious on those issues so that we don't get the allergies, and we can treat allergy with the eye drops. And there are different types of eye drops that can help. The fifth reason is people who've been using drops, mostly like glaucoma patients, they have preservatives in the drops, and those preservatives are toxic to the corneal epithelium and the conjunctiva. They cause irritation. 6, sometimes people who are smoking, the smoke causes irritation of the eye, and because it's a toxin to the cornea and cause irritation. 7th, I like to touch on the air pollution. Our air is getting very bad, more so in California. This bad air is irritating our eyes, and we have no way except to avoid contact outside with the bad air or use eyeglasses so the air does not hit the eyes directly. And the next one could be the nutrition. Our food habits have changed. We need to start taking whole wheat, whole food so that we get good nourishment and we don't develop vitamin A deficiency, because vitamin A deficiency also causes irritation of the eye and also affects the vision, because night vision can be bad if vitamin A is not in our diet. I think these conditions could help you to avoid the eye irritation, and I'm stopping here.
Well, that was very enlightening. And I think that one of the takeaways I have from that, if I might, as a layperson interject, there are so many possible causes for eye irritation that you really need to see your doctor. If you wander up and down the aisle at the pharmacy, you might get the wrong thing that would do you more harm than good. And so you have to have a proper diagnosis to get the proper treatment.
Oh yeah, we also, the pharmacists sometimes give you over-the-counter drops, and they have preservative. They're not good for the health of the eye. So when the patient comes in, tell them don't use over-the-counter drops.
Yeah, I certainly will not, and I will certainly be getting a professional opinion and not trying to be my own eye doctor. Thank you, Dr. Fagoora. Until the next time, we've learned a great deal.
Thank you so much, Tom.